So liver disorders, especially patients having liver disorders, they come for Ayurveda doctors, Ayurveda physicians usually, because Ayurveda medicine has a better role in the management of liver disorders. We get the liver. So actually, due to environmental pollution, altered lifestyle, food habits, and psychological stress, and chronic alcoholism is a common factor. The incidence of liver disorders has been raised. Especially you can see even the youngsters they are addicted to alcoholism, chronic alcoholism, and it is not a good development. But however, the incidence of alcoholic liver disease also has raised. The viral hepatitis cases and drug-induced viral hepatitis is the second category which is commonly seen, and drug-induced is a little rare. We get common viral hepatitis and alcoholic liver disease, the most common, and the third one is the hepatocellular carcinoma or secondaries in the liver. So cirrhosis of the liver is the one of the common disease which is seen affecting the Indian population. I will discuss later. Oh, yeah. So the medicines which are used commonly are Falatrikati Kashaya, Guduchi Kashaya, Aragyavadini Vati, Bhumyamalaki Swarasa, Budanti Vasma, Triphala tablets, and Pravala Panchamrataras. These are all few formulations so commonly used in the management of liver disorders. So Triphala tablets, Triphala Kashaya, Guduchi, Henospora cardivolia, which has a hepatoprotective effect. It has a hypoglycemic effect, a cyanide effect, immunomodulator, and also hepatoprotective. Udichikwata is very frequently given in case of hepatitis patients. So the contents introduction, classification of liver disorders. This is the only related to the disease liver disorders which is encountered in the clinical practice. Okay. And Ayurveda management of liver disorders, discussion, conclusion, and references. These are there. Yes. Right. Which we have discussed. So you see the if you see the study the histology of the liver, you can see on the left side that is the normal histology, hepatic lobule. You can see in the central vein, followed by the hepatic lamina, concentric hepatic lamina, the hepatocytes, which are polygonal and epithelioid cells. By this the lamina of hepatocytes, this is arranged concentrically and between the lamina, there are sinusoids and bile canal tributaries. And the liver and in the periphery, there are portal triad and hepatic triads. Portal triad consists of a branch of the bile canaliculi, portal vein, and hepatic artery. So while functioning physiology of liver, we can remember, we can recollect the metabolism of proteins, fats, and carbohydrates, storage of glycogen, storage of vitamin, detoxification of drugs, and erythroclasia, erythropoiesis in the embryo, and secretion of bile, which has the role in the digestion of the fat which is ingested. These are some of the, and also these immune system, tougher cells which take part in the immune system. These are the main functions of the liver. When the liver is affected, either inflamed or degenerative changes like cells of the liver, functions of the liver is deranged. We can see the liver is a chemical factory of the body, which is mainly dealing the metabolism in the role in the metabolism. Isn't it? And when liver is and liver is only one in the body, and if the liver is damaged, there will be so much concern in the health scenario. Isn't it? So this symptom, alcoholic liver disease is very common. We'll first classification. Yeah. You see, these are the main disorders or common disorders that are seen in the clinical practice, common clinical practice. Viral hepatitis, that is hepatitis C, hepatitis B. Hepatitis B is a chronic, usually used to chronic active hepatitis and fulminant hepatitis and hepatitis renal failure sometimes. Hepatitis C, hepatitis 1A, 1B, these are some of the viral hepatitis cases. And the second one is alcoholic liver disease, which has three stages. First stage is alcoholic steatosis. Second stage is alcoholic hepatitis. Third one is alcoholic cirrhosis or Lanex cirrhosis, also known as nutritional cirrhosis. The other diseases like amoebic liver abscess, hydrated cyst of the liver, carcinoma of the liver, primary carcinoma, hepatocellular carcinoma, secondaries in the livers by the hematogenic spread, and cirrhosis of the liver. We get commonly disorders patients with hepatitis and cirrhosis of the liver. This is a normal history. You can see the hepatic lobule, okay. Central vein in the center, and portal triad, hepatic triad at the periphery. In between, there are concentric hepatic lamina with sinusoids and tributaries of their canal. This is, you can see histology of fatty degeneration of the liver. That is known as alcoholic steatosis, fatty liver. You can see in the hepatocytes, the main portion of the cytoplasm is occupied by the fat globule, and liver and the nucleus is pushed to the periphery. That is eccentric nucleus. It is seen in this liver, fat, fatty liver or steatosis. This is a normal liver, you can see. Not that histology. This is the cirrhosis of the liver. The histopathological slide. You can see in the render, you can see actually the fibrosis, extensive fibrosis. You can see how not a Y-shaped area. You can see its entire is a fibrous tissue, and in the periphery you can see it is focus. You can see the nodules. So in the cells of the liver, there will be damage to the hepatocytes, and they get necrosed, and they will be replaced by the extends hepatic lobule, and they lost the lobular pattern and become nodules, hepatic nodules, and extensive fibrosis, which deranged hepatic function or decreased hepatic function. Sorry. So you see symptoms of alcoholic liver disease. You can see here abdominal swelling, dry mouth, bleeding from enlarged esophageal veins, yellow, that is esophageal varicosis. Right. Then yellowing of the skin, red spider, navy, redness on the feet, memory problems, numbness in extremities, and fatigue. So this is the MRI scan. So fat degeneration we have risk. Commonly, these formulations, RS formulations are used in the management of hepatic disorders. It may be degenerative or inflammatory. Okay. Like Triphalakashaya or Argyvardhinivati. The main principal ingredient of Argyvardhinivati is this one, Katkuroini, isn't it? That is Picrorhiza kuru. Palatrikadi Kashaya in these areas, Palatrikadi Kashaya is very commonly used in the treatment of hepatitis. Okay. Palatrikadi Kashaya contains Triphala and four bitter drugs like Bunimba, Katkuroini, and Guduchi, and another one, Nimbat, isn't it? So that is very commonly used in hepatitis patients. Pravada Panchamrita Rasa, Mukta Panchamrita Rasa, Kamaduga Rasa, Udani Basma, they are very commonly used. You can see Pravada and the Pravada Pishti, Mukta Pishti, Pravada Basma, Mukta Basma, Bunimadi Kashaya, Kumarya Sava, Narikela Jala, Punarnavaswarasa, Punarnavadi Mandora, Guduchi Kashaya, and Kakamachi Sarasanda, Kamasaras. Okay. So the fermentation and combinations are done of these medicines as per the this morbidity or uh, pathology, stage of the disease. Okay. Because, for example, just the liver, we give usually high protein diet and dietetics like Pranavadi Mandora and Pranavasta Kachaya, Aragavardhinivati, hepatoprotectives like Aragavardhinivati, hepatic stimulants, Guduchi Kwata, these medicines are Pravada Pishti, these are Kakamachi and Narikela Jala, very commonly in hepatitis patients. I used to ask patients to take daily 2 or 3 Narikela Jala, uh, tender coconut water along with the medicine. In hepatitis, you see the medicines, they are usually Aragavadinivati, Palatikadi Kachaya, Guduchi Kachaya, Bunima Malakisarasa. In hepatitis B, Australian antigen is positive. In such cases, usually Bumia Malakisarasa is also effective. So tablets are coming in the market containing Bumia Malaki. Pylanthe is every. The research has been already conducted in BHU. Dr. Ramji Kanoja, my senior, has worked on Umya Malaki on hepatitis B patients, and he had found it is effective. Okay. So and also Alabu, Mulaka, these are the Patyas, Pranavasarasa and Akshasarasa. Kisarasa, this sugarcane juice. Usually, I used to ask the patients of jaundice to take the Ikshasarasa also. Tender coconut water as also Ikshasarasa. So actually, in everybody knows, isn't it? In viral hepatitis, first symptoms will be like yellowishness of the sclera, conjunctiva, tongue, or back of the tongue, skin, itching in all over the skin, weakness in the thighs or lower extremities, isn't it? Yellowish urination, sometimes dark urine also seen. These are the most common symptoms of hepatitis. So, hepatitis may be due to alcoholism or also due to viral infection or due to drugs. Common are the viral infection and the alcohol. So, it is diagnosed by the liver function test, abnormal liver function test. The serum total bilirubin is raised and albumin globulin ratio may be reversed, isn't it? And alkaline phosphatase is raised, SUT, ALT, AST will be raised. Everybody knows. Then they will confirm that it is a case of hepatitis and it is also due to viral hepatitis. We follow this patya like high carbohydrate diet, fat-free diet, Ikshurasa, Shashtikashali, Narikela Jala, Lagusupachara. These are the patyas in case of hepatitis. Apatyas are fried and curried food items, excessive salty and pungent food, Atikatu Amla Lavana Sevana, exercise, Atava Sevana, exposure to bright sunlight. These should be avoided because these increase the pitta and the Kamala is a pitta valley, isn't it? So they are all contraindicated. Single herbs used in liver disease. Ekamalka prayer, Guduchi, Tinaspora, Cordipolia, Patukurohini, Kuraizakurva, this is the best hepatoprotective drug. Umya Malaki, Phyllanthus, Neruri, Tripala, 3 myrobalance like Haritaki, Vitaki, and Amalaki. Bunimba, it is andrographis, maniculator, Kiratatikta, Swarshyacharayata, and Kakamach, Salam. And Dronapashpi, Lucas aspera, Ikshu, Sakaram, officinarum, Bhokshura, Trebulus registris, directed drug. Pranava, Burhavia diffusa, Mula uses, Panchanga, Karavelaka, Memorica Charantia, and Mulaka radish, and Alabu, butterbar. This is the Mulaka and Alabu. I ask the patients of jaundice to take this as food along with food. This is Patya. Now let us see the cirrhosis of the liver. Cirrhosis of the liver is a condition where there is a necrosis of the hepatocytes followed by abnormal regeneration and formation of multiple nodules and extensive fibrosis and decreased liver function. The symptoms, common symptoms are history of alcohol intake will be there, chronic, usually, and symptoms of loss of appetite, distinction of abdomen, ascites, bilateral pedal edema, liver palm, or bluish purple discoloration of the palm. Then thin limbs, the emaciation will be there, and there will be gynecomastia, then ecchymosis or petechiae, caput petechiae. There will be a coffee ground vomiting often, that is due to hematemesis, seen in the complication like esophageal melena, coffee ground, melena is black, tarry stools. So if you do occult test for occult blood in the feces, that will be positive, and these symptoms. And then later, there is due to severe ascites, there may be the and fluid retention, there may be symptoms of lung congestion, base of lung congestion, pulmonary edema, and respiratory distress, and symptoms. As to complications like left ventricular failure and encephalopathy and diarrhea, electrolyte imbalance, they are commonly seen in the irreversible liver patients. The caput medulla and other telangiectasia, chemosis, melena, coffee ground vomiting, hematemesis, gynecomastia, and amenorrhea. The medicines in cirrhosis, usually in medicines, we give high protein diet, important because serum protein will be lower. Total serum protein will be lower than normal. Hypoproteinemia will be there, and albumin globulin ratio is reversed. Normal is 3:2. It will be reversed. It will equal or it will be low. So you have to go high protein diet, Ipanapachana Aushadis, and you have to give Rasayana drugs, hepatoprotectives, hepatic stimulants, coalagogues, and the diuretics, and Jeevaniya, Vajaskara, Vayastapana. These drugs has to be given, isn't it? So on main drugs used in cirrhosis, and the types are listed. There is alcoholic cirrhosis, then biliary cirrhosis, then Indian childhood cirrhosis, cirrhosis due to hemochromatosis, cirrhosis due to Wilson's disease, cirrhosis due to unknown cause, cryptogenic. There are some of the types of cirrhosis. We have to evaluate the cause of cirrhosis, then accordingly we have to treat. Especially in alcoholic cirrhosis, these medicines are useful. These are the most common type we get in the wards and clinics, that is alcoholic cirrhosis. Cirrhosis is a pre-malignant condition. If you do alpha fetoprotein, if it is high, it's a marker of malignancy. So the big case usually is a turn to malignancy, isn't it? So medicines is given, Palatrikadi Kashaya, Ragyavardhinivati, Pananavadi Mandora, and Pravala Panchamritarasa, Mukta Panchamritarasa, Yakradariloha, Yakrat Liharlo. Then give also Karjuradimanta. Karjuradimanta ingredients are Karjura, Draksha, Tindadika, Dadima, Parushaka. There are also the main ingredients of Karjuradimanta. And it's got nutritivities, isn't it? And it soothes the mucosa of the stomach mucosa, irritation, stomatitis symptoms are that will also relieve alcoholism. And also it is nutritive. It's really given in alcohol remedies also. Themselves also can, when it is associated with the alcoholism. The other medicine cirrhosis, like Pranamadi Mandara, Pranam diuretic, because of fluid, water retention will be there. Sodium and water retention, you have to give diuretics. So you can give Pranamata Kashaya or Pranamadi Mandura, Ukshara Bija Charna. Yes. Then Vajaskara Shatavari Churna also you can give. Shatavari Churna is Jivaniya Aushad. Jivaniya in Samhitas, Jivaniya Aushad is 8 Ashtavarga Satru, isn't it? Jivaka, Jabaka, Kakuli, Kirakakuli, then Radhyavritti, isn't it? Now, these medicines, most of the medicines are not Ayurvedic. There are substitutes like Shatavari, Vidarikanda, Varahikanda, and Ashwagandha. These four are the they are given in the place of Ashtavarga in double quantity, and it can be used as a uh, Jivani and Vajaskara. Milk, we usually give the Pepperleaf Sherpa. Pepperleaf Sherpa, it is Dipanapachana and also nutritive also. In cirrhosis of the patients, very commonly used. That is for this food and medicine. Is Pepperleaf Sherpa. However, we restrict if a severe general sarca is there, severe ascites is there, we have to restrict what salt and water. And we have to monitor serum total protein as well as serum electrolytes repeated. So as per the patient's condition, we have to we have to plan the treatment, isn't it? Depending upon the extent of damage, extent of involvement of different systems, we have to treat accordingly. However, we use mainly the Ayurvedic medicines instead of modern medicine. When it is not when in Ayurvedic medicines, if we are not able to control, then we seek help. Either we use modern medicine, we seek help the uh, modern medicine. Suppose bleeding hematemesis is there, then you give cold, cold, cold milk, cold milk morally can give, and you can give Chandrakala rasa, Molabadha rasa, Hirasa, these you can try. Rakta Pitta Kalakanda rasa. If not then you have to give the other modern medicines. Diarrhea is there, similarly, you have anti-diarrheal drugs. If there is a symptoms of pulmonary edema and respiratory distress, we have to give diuretics, like Pranamandara, Pranatapashaya, or Bush-based. We have to give the expectorants, etc. Symptomatic treatment. Oxygen is there, oxygen should also be given. Patya synthesis, high protein diet, low salt diet, fat free diet, Alabu, Mulaka, and Yavamanda, Narikela. The main patyas. Patyas, fried and curried potatoes, fat containing food, Atikatu, Amla, Lavana, Rasayukta food, and Pitta, Vardaka, yeah. The main uh, in fatty liver, as we have seen the histological slide, the uh, in the liver tissue, hepatocytes are studied with the fat droplet, fat globule, and nucleus is pushed to the periphery, and that is the fatty degeneration of the hepatocytes. And the symptoms will be obesity, high fat diet, or causes, high fat diet, diabetes mellitus, and alcohol. They are common cause. Symptoms: loss of appetite, obesity, lethargy, and occasional constipation. The medicines in fatty liver, Kataki Kashaya, Buduchi Kashaya, Google preparations, they are Medohara, isn't it? Kasharogulu, Yavarajogulu, Nakogulu can be given. Ramnatadi Kukulu can be given. Varunadi Kashaya, Aragavadini, Galatari Kashaya can be given. Bhatyas in fatty liver, Takamachi, Salsa, Alabu, Molaka, and Narikela. Preventive measures like intake of Madhura Rasa, Pradana Ahara, avoidance of Pitta Vardaka Ahara, is in hepatitis liver disorders. Okay. Liver disorders, the preventive measures are we have to ask the patient to avoid Pitta Vardaka Ahara, sunlight, avoidance of curried, fried, and vidai food, avoidance of high fat diet, less intake of excessive, less intake or excessive, less intake of Katu, Amla, and Lavana Saita. And Tikshna and Ushma Ahara should be avoided. Then next, coming to amoebic liver abscess, it is very rare, isn't it? So you had better use of anti-amoebic treatment and not control surgery. Hydatitis of the liver is also rare. Is due to worm infestation and treatment so surgery. In hepatocellular carcinoma, get cases, symptoms are loss of appetite, progressive weight loss, progressive anemia, and the alpha protein will be high. Emaciation will be there. Day by day, loss of appetite, increases, emaciation will be there, weakness, these symptoms. treatment like Amrita Ballatakalayah, Ballatakavati, Chitrakadivati, Chitraka Haritaki, Leha, Palatikadi Kashaya, Aragavadinivati, Kanchana Ravukudu, Raudra Rasa, Sada Pashta, Patra Sarasa, Inkarosya, Patra Sarasa is given. Chitraka is anti-cancerous, and Ballataka is also anti-cancerous drugs. Let's see, however, there is a palliative treatment. You cannot give medical treatment or complete cure. Only palliative treatment can be made in case of carcinoma of the liver or cellular carcinoma or secondaries in the liver. Both. So when you have to get in secondaries in the liver, first you have to treat the primary site. So carcinoma, blood sports, etc. Either by surgery or by chemotherapy or radiotherapy. Then we have to follow the treatment secondaries in the liver also. Well, this is also palliative treatment. Complete cure is not possible. In alcoholic disease, we have discussed three stages: steatosis, hepatitis, and cirrhosis. So these are tests everybody knows. So these are tests. Here, the liver function test used in liver disorders. These are the medicines. So suppose the vomiting, sore irritation, burning in abdomen, are these symptoms are there. Can give multiple sign. If loss of appetite is there, mixture of lemon juice, ginger juice, and sandalwood. This is very helpful. This is my guide. While PG, he told me, he told Dr. S.M. Tripathi sir, he has told this. And other medicines, Kumaryasava, Alatikadi Kashaya, Oluchikata, Drunapishwarasa, Pipali Shirpaka, Ardhavana Pipali Kalpa, Vetakarishta, Pranavadi Mandara, Pranavashta Kashaya, Shetapatpati. Shetapati is diuretic. Diuretic is also Marikela Jala. In jaundice patients, they usually give the medicines or Gozindivasma with Narikela Jala, Chandravagana water. It has a better result, good results. If Narikela, here it is costly, some patient may not afford 3 Narikela per day. Then barley water, Yavamanda is other medicines, Ushara some diuretics and Pitahara. Aushadis like Pravar Panchamurta, Mukta Panchamurta, Pravar Pishti, Mukta Pishti, Pravar Vasma, Mukta Vasma, Vasma. They're all Sudhavargi Aushadis. They are useful. They are found useful in the management of hepatitis, especially hepatitis, inflammation of the liver cases. In our ARD, the diet is bland diet, and hepatitis is low salt diet. In cirrhosis conditions, high protein diet, Madhurasa Pradhana Ahara, Mudga, Masha, meat, eggs, chicken can be given after correcting appetite. Cirrhosis of the liver, and these food items are rich in protein. Because in cirrhosis conditions, there will be hypoproteinemia. They are supplement protein by the food. In hepatitis condition, symptoms like nausea and vomiting will be present. Hence, Lagusupachahara, Dipanapachana drugs should be given. These are the food items which can be given. So, last I can see Mamsa can be given in cirrhosis only after giving Dipanapachana. Can you people share paka? The appetite increases, the minimum is relief, then you start the Mamsa. Coming to discussion. Liver disorders are usually present with jaundice, loss of appetite, lethargy, and later stages results in ascites, anemia circle, and emaciation. Extensive damage of liver usually ends in cirrhosis of the liver or hepatorenal failure. In most terminal stages, there will be altered sensory like stupor, delirium, recoma, and death. In encephalopathy conditions, the symptoms are same. Loss of appetite, weight loss, and jaundice are the most common symptoms in liver disorder. We can see different stages. The normal liver turning to hepatocellular carcinoma, cirrhosis of the liver, and lastly, hepatocellular carcinoma. So you can see fatty lesion of the liver, hepatitis, then cirrhosis, lastly, carcinoma. So these are the symptoms. Liver. So viral hepatitis usually get cured within 1 month by proper treatment. Hepatitis B, of course, sometimes leads to chronic active hepatitis. and cirrhosis of the liver. Cirrhosis of the liver in initial stage responds well to Ayurvedic treatment, and in later stages it will end in incurable stage. This patient and in gross societies, left shoulder failure, and pulmonary edema. Some patients develop severe anemia, increasia, and also elements. It is considered pre-malignant condition. Cirrhosis is considered pre-malignant condition and ends in carcinoma of the liver. Certain hepatotoxic drugs like AKT, NSAIDs, and alcohol cause liver damage and hepatitis. In such cases, we have to stop the ingestion of drugs and alcohol, and rigorous treatment for hepatitis and suitable patya should be followed. Hepatocellular carcinoma is usually fatal. Even secondaries in the liver cannot be completely cured. Only palliative treatment can be given in such conditions. In nutshell, conditions. Coming to conclusion, Ayurveda medicine has a positive role in the management of liver disorders, alcoholic liver disease, and cirrhosis of liver. It gets if I get Ayurvedic treatment in earlier stage, better will be the outcome. So earlier the stage, better will be the outcome. If the hepatitis liver, fatty liver or alcoholic status or even alcohol hepatitis, they respond better compared to alcoholic cirrhosis. Very often, later stage of alcohol cirrhosis, patient may die due to pulmonary left ventricular failure, pulmonary edema, or shock, or even hepatic encephalopathy, or electrolyte imbalance. However, in later stages, the treatment becomes difficult in cases of alcoholic liver disease and cirrhosis of the liver. By following disease-specific medicines for comorbid conditions, following strict patya, diet and alterations in lifestyle results in better outcome in these patients. Patya play a significant role in the management of liver disorders. Now that is told, isn't it? Patye sati gadartasya kimaushada nishevanam. Patye asati gadartasya kimaushada nishevanam. Means when suitable patya is there, even medicine may not be necessary. With the patya only, the disease will be cured. On the contrary, if good, very best medicine is there, but there is patya is not followed, suitable patya is not, that will not give the result. That is told in Ayurveda. So these are the patyas you can see. Yogasanas can be done. Liver disorders. Yogasanas are anti-stress, right? They help in Yasana effect is there. In the food also, we have so many food items which is patya in liver disorders, like halabu and ikshu and mulaka. They are specific for liver disorders. So thank you for giving me opportunity to share my experiences with the August audience. Thank you.
Thank you, sir, for your wonderful lecture. If anybody has any questions, Dr. Manjula, madam, please conduct.
Yes, sir. Now the session is open for discussion. If anyone wants to ask question, that can directly ask it or they can put it in the chat box. I'll be reading it out.
I think there is question or not?
सर चैट बॉक्स में तो नहीं है.
Any hand raise? नहीं है,
Just
sir.
नहीं है सर.
Okay, sir. Thank you, sir, for your wonderful lecture, and we will want to hear you again and again. Thank you for your wonderful lecture. I think you have delivered so nicely that all the scholars are satisfied with the presentation. So we will end. On the behalf of Vishal Professor, sir, we give you wonderful thanks for your wonderful lecture. We will end by the Santi mantra. Om Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadyani pasyantu, ma kasid bhag bhavet. Om Santi, Santi, Santi. Thank you, sir. We will end the meeting now.